Hi. Today I want to talk about some of the interventions that I do, clinical interventions that I do with my patients using dreams, and it's called dream analysis. I come from the platform of Carl Jung, and where dreams are viewed as a message sent by the person who actually creates the dream to oneself. Now, it is my understanding, and it's my perception, and it's my position that the person who creates the dream is the person who can identify the message, and the dream comes with symbolisms. The dream is not, it doesn't have a linear language. It's more like the Mayans or the Egyptians that use symbolism to communicate with each other by symbols. The dreams are very similar. Now, the dreamer is the one who will have to come up with the definition of each symbol, because the dreamer is the one who made the dream. But the therapist is the one who's able to help the patient, because he's detached from the emotional charge of the dream. And so the therapist is able to help the dreamer navigate through all the emotions, up and downs, the fears, the anxiety that comes with the dream and the message of the dream. And once the dreamer receives the message of the dream or the thematic of the dream stop. There's no need for that message anymore, because the dream already, or the message in the dream was already received by the dreamer, and that stopped. Now, there are many symbolisms in the dream, like for instance, the characters. If there is the mother figure, if it's the father figure, if it's the sibling figure, if it is the partner figure, if it is a figure of power, which could be your boss, could be the judge, could be the police. If there is an animal, if it's like a black cat, if it's a dog, if it's a fish, if it's a shark, if it's a lion, if it's a hen, if it's an egg. So there are many different possible symbols that come with the dream, and with the assistance of the psychotherapists who have been trained and having practiced dream analysis for a while, the dream is a very powerful tool to use to help the patient identify some fears, some messages that the patient is not able to receive consciously, but subconsciously or unconsciously, with the message of the dream is able to help the individual understand maybe some grieving, maybe some bereavement, maybe some fear, maybe some anger, maybe some resentment, maybe some anger, many different issues that might be affecting the individual and the relationship with the people, or family members, or members of the emotional support system, or co-workers, or anybody around us in a relationship world. So understanding our dreams are very important, because it help us to come to terms with, well, what are we thinking, and what are we feeling about life, about our relationships, about how we view the world, about some of the worries that we might have that might create depression, that might create sadness, that might create anxiety, that might create conflict in a relationship, that might create lack of hope, despair. So understanding the dreams is very important. If you have any questions that you want to ask me individually, you could contact me using my website at www www.counselingbyroberto.com. Again, it's www.counselingbyroberto.com. There is a place where you could ask me a question, and I will respond to the question as soon as I can. Until the next time, keep dreaming. Don't be afraid of your dreams. Embrace your dreams. Try to find out what it's the meaning of the dream, and if I could help you in any way, let me know. Until the next time, be good to yourself, enjoy life, and be safe.